I'm very proud to have played a pivotal role in the health care legislation. I worked hard because I believe that what we started with on the floor of the Senate was not exactly where I would have gone. I worked very hard prior to that in the 22 months that we debated it in the Senate Finance Committee, and we produced a bill out of the Senate Finance Committee that I felt like was very productive. I thought it was very pragmatic and realistic. It was focused on not only providing health care in a delivery mode that shifted us from focusing our delivery from volume and reimbursing for volumes of health care that were delivered to directing ourselves towards value that was delivered. Because we know that in value, and when value is delivered, then you're going to bring down the cost. Because the better your outcome in health care, the less likely you're going to be readmitted to the hospital or put into long-term care or suffering from escalated chronic diseases that get to a worse condition that are more costly to care for. And we did do a good bill. It was deficit neutral. But you know what? As we went through that compromise, and those of us that kind of planted our feet and said there's a few things I can't live with, we began to come up with a bill that I think solidly is good for Arkansas, and it's good for this country in terms of the policy that we produced. We were able to create a bill, again, that covers 400,000 more Arkansans. We have about 500,000 Arkansans that are uninsured right now. The fact is 77,000 of them are children. But of those 77,000 children that are uninsured in Arkansas, 2/3 of them are eligible for our kids. They're just not enrolled. 230,000 of them are eligible for Medicaid currently under the current program, but unenrolled. We have to use the vehicle of this bill to be able to get people into programs that they are eligible for now and not recreate a wheel or reinvent a new program to try and cover people that are already eligible for current existing programs. And that was one of the things that I worked hard on in this bill. I worked hard for small businesses because I believe small businesses will get about $40 billion in this bill of assistance to be able to get into the marketplace. We create a marketplace that they can work in. We give them exchange pools just like we have as federal employees and members of Congress. And in there, they can pool themselves with the other 25 million people that are either small businesses, self-employed, independent contractors. And in that pool, they can leverage with the private marketplace and private employers, insurers, just like we do as federal employees. We go into that private marketplace, and with 8 million of us, we've got pretty good leverage to get a good deal out of those private insurers and in that marketplace. And that's what we're going to do for small businesses, along with tax credits that start in 2010, and then a new exchange pool in each state, the ability to purchase insurance across state lines. The fact that we are now putting into place the ability for national insurers to be able to offer multi-state plans. So a national insurer can offer a plan in 50 different states. States can create compacts so that you can purchase a plan for your small business from the state of Mississippi, or an insurer in Mississippi, not the state of Mississippi, but an insurer in Mississippi or an insurer in Missouri. If we build that compact, they'll still be regulated by state Arkansas Insurance Commission, but they will be able to within that compact, move those insurance products across those state lines. So there's a lot of really good things, practical things that we need to do in here. I didn't agree with what Ben Nelson did, or with what the leadership did. I didn't think it was right. I don't think you sent me up there to be a horse trader. I work hard to make sure that Arkansas gets its fair share in appropriations, and I think we do a good job in bringing that home. I know I do in my office, and working with the rest of the delegation we do. But I also have to weigh out the things that I do think are important in this bill, and I felt like moving forward on this bill in all of the things that we could do in comprehensive health care reform were important, and important enough to move down through the next process. No one is going to see a cut statutorily by law. If you are eligible for Medicare, you have to receive the core benefits of Medicare, the guaranteed core benefits of Medicare that are there. No one can take those away from you. Now, some of these Medicare Advantage plans in some of the ritzier areas of the country where you've got large volumes of seniors that live in a small area, you know, they're more than likely higher income seniors than what we have in the rural parts of Arkansas. They get a plan that may cover their membership to the gym. It covers their multivitamins that they take once a day. It covers everything. The problem there is we're subsidizing that. You and I in Arkansas are subsidizing those unbelievably fruitful Medicare Advantage type you know, managed care plans for other seniors in other states. And that is something that we shouldn't allow to happen. And so in this bill, we went in, and where Medicare Advantage plans were working, mostly on the West Coast, places like Oregon, maybe Washington State, where they have efficiently put into place these managed care products in Medicare, and they are getting the biggest bang for that buck. They're not really harmed. But in areas where they are being heavily subsidized, and they're producing products that have a lot more than just that core benefit, and they're things that you and I shouldn't be subsidizing, we're going to be reining those in, and I think that's appropriate, because I don't think that Medicare beneficiaries or workers in the state of Arkansas should be paying for that 12, 14, whatever 15% subsidy to a Medicare beneficiary in another state, and that has happened, and that's where. And I'd be more than likely, if what happens, the gentleman just brought up Senator Nelson, you know, if that continues to happen, you're going to see that reined in, either here before we even start down the road, or at some point down the road where people realize that, you know, when you've got a core benefit like you do in Medicare that's guaranteed by law, it needs to be delivered equally to all people. And then if people want to purchase up, which they do, most people do purchase a Medigap policy or some kind of supplement policy, then they can do so. You know, those are some of the inefficiencies that exist out there. And that is an inefficiency, in my opinion. It's an overpayment in Medicare, and it's something that we should rein in, and we're doing that.
So, you know, we got too many Nelsons up there in Congress.